Okay, we're at about half our RSVP volume right now, and Kirsten, who's managing our platform for us today, will continue to let them in as we progress. I thought I'd start with just a little bit of light housekeeping. With so many folks on the line today, I want to let you know that we're asking all of you to please self-mute, and if we hear any background noise, we may have to step in and mute for you. Also, to navigate so many questions, we're encouraging everyone to use the chat feature. In this environment, it's probably difficult for me to imagine that you all haven't Zoomed a lot, but just as a reminder, your chat feature is found at the bottom of your page in the navigation bar. You should address questions to Polk Vision. That will enable Kirsten to consolidate questions that are similar and assist in navigating the questions between Drs. Jackson and Kate. Either will be willing to accept specific and or general questions. And I want to just let you know that if you miss anything or if you miss a portion of this session today, it will be recorded, and the recording will be made widely available on polkvision.com, Facebook, YouTube, and the Lakeland Regional Health resource tab on their website. We will be sending links out to all participants and all of those that RSVP'd and may have missed today's session following our meeting today. The next slide just is a general disclaimer. It will remind all of you that today's conversation is based upon information that is known to us today. It's a moment, we're dealing with a moment in time in a very fluid situation, and we're referring to and abiding by leading health organizations, including the Centers for Disease Control and Prevention. And with that, I'll conclude my housekeeping remarks and turn it over to Lakeland Regional Health's Lauren Springfield.
Good morning, everyone. My name is Lauren Springfield. I am the Manager of Community Health at Lakeland Regional Health. We are so excited to bring this conversation to you this morning. Lakeland Regional Health thought that this was really important in addition to forming an online business resource center that we'll share a little bit about at the end of our conversation. We have been working so closely with the Department of Health and Polk Vision and the rest of our community leaders to ensure that our community feels supported as we navigate our new normal. And so today's discussion, Dr. Jackson is going to kick it off with a brief overview of where we stand as a county. Dr. Haight is going to go over a lot of best practices and things that he has seen and is recommending both from the CDC and from other leading health organizations. Both Dr. Jackson and Dr. Haight will be available to answer those questions that you type into the comment box to the best of their ability. If we do not know something specifically or need to gather more information, then we'll make sure to do that, and we'll be listing all of those, like Kim said, in our Business Resource Center as a response. And so we look forward to this discussion with you and interaction and giving you this important information. And I would be remiss if I did not thank Dr. Jackson and Dr. Haight for the incredible job they are doing in our community. They really have just stepped up to care for every member of our community and make sure that we are all safe. So thank you both. And I will turn it over to Dr. Jackson.
Thank you, Lauren. I certainly appreciate the opportunity of participating in this call today, both from the standpoint of working with Polk Vision and Lakeland Regional Health as very strong community members. I'm also very appreciative of being able to speak with our business owners, our employers, and our front line that is facing the public during these unprecedented times. I don't think any of us could have predicted a number of months ago that this pandemic would occur, but I think that we are showing that we're fluid, that we adapt, and that we're constantly reading to learn best guidance and best advice from leaders, and that we implement these, because not only within your workplaces, are you working to protect your employees, but what you're doing is protecting the community. And for that, I'm very appreciative. So I'd like to give you an overview of what is the status of COVID in Polk County right now. So Kirsten, if you could go to my first slide, please. And my slides are unfortunately very busy, but I want to let you all know that you have access to the dashboards on the Department of Health website. So if you just Google Florida Department of Health, there are different dashboards. There's a statewide dashboard, there are county dashboards. You can get into some trending data. There's information about long-term care facilities and prisons. So there's information that's being updated. Unfortunately, there's been a lot of media attention with some shenanigans, which is still being worked out. But I will tell you that I've gone to some of the base data for Polk, and I feel very comfortable that our key metrics of new cases are extremely accurate on the dashboard. And I feel that I'm a data person. I don't think we can fix or monitor things without having appropriate data. And I do feel that what we're seeing from Polk County is very reliable and accurate. So we started this journey in Polk about 10 weeks ago. Our first case of COVID was recognized in Polk County. It was either March 16th or March 17th. So over the course of the past 10 weeks, today we're actually going to be at a little over 900 cases in the county, which puts us at 11th in the state for the number of diagnosed COVID cases. Now you may ask yourself, is this all the COVID that is in Polk County or across the state, which is now over 52,000 cases? The answer is no. These are the cases or the individuals that have had a test that was positive and that was reported through the Department of Health. So this is a snapshot, and there's been variations in what's the relationship of diagnosed cases and how many cases are out there. We go to school regularly on other communities that have been involved in COVID longer. Some communities are saying that your data, you need to multiply it by 10. Others say you need to multiply it by 50, but there's no real research yet to know what the relationship or the ratio should be. My main point is that we still very much have COVID within Polk County. What this slide shows you, and what I wanted to point out, are the high-level demographics. You can see on the left are cases by race. You can see male-female relationship. Interestingly, Polk has had more females than males. And I think a fair amount of this is we've had well over 200 cases in long-term care facilities. And so I think a lot of the female predominance has been related to folks in nursing homes. You can see the age distribution across the top bar graph, and our median age is 53. Median age varies from week to week based on whether we've added cases from a long-term care facility and whatever. But this is the data for the 10 weeks we've been involved in this. Across the bottom are the new cases that are reported to the Department of Health on a daily basis. So this particular graph shows cases, and you can see the date on the bottom, and you can see the number of cases on the axis on the left side, and this goes up to May the 24th. If you can go to the next slide, please. Now this slide is also available publicly on the Department of Health website, and this is a dashboard it's called Florida Health Metrics. So if you go on the Department of Health dashboard, you can then select for Polk County and can get to this. What I want to point to you is the upper right graph is actually the same thing as the daily graph, but it's grouped by week, so you can see a trending. It's easier to see the trending. So you can see over the past 4 weeks that we are running between 100 and 120 new cases diagnosed on a weekly basis. So unfortunately, we're not seeing a drop off yet. On the bottom right, you'll see our trends for percentage of our tests that are positive. And I'm going to talk more about our testing on the next slide, but I just want you to see that we are doing more testing in Polk and that the percentage of positive tests are decreasing, which is good. You want to have your percentage of positive tests under 10%. that shows that you're doing a good amount of tests. The lower it gets, does that mean we have less disease? It could be, but it could also reflect the fact that we're doing more testing. So we have to look at these metrics sort of cumulatively to tell the story. The two graphs on the left are sort of what I call the early warning signs. So we're able, through something called syndromic surveillance, to monitor cases that are seen in Polk emergency departments and the way that they are coded. And we look for emergency department visits with flu-like illness and emergency department visits with COVID-like illness. And we're hanging in there. We initially had some improvement in flu-like illness. We have, which has gone back up a little bit, and then ED visits with COVID-like. So again, these are sort of an early warning indicator. Is there something going on? Clearly, we're going to be watching this closely as the effects of a little bit more opening and the long holiday weekend. My epidemiology team is watching this data. They watch it like a ticker tape from the stock exchange to see if it's changing. So very critical data pieces to see where we are to measure the disease activity in the county. If you go to the next slide, please. Now, this slide is a component of another county report, and what this is showing you is a daily tally of how many tests are done in Polk. I'll tell you, from the beginning of the outbreak, Polk has conducted nearly 19,000 tests of individuals. So that's overall. This bar graph shows you on any given day how many negatives, which is the top gray number, how many positives, which is the bottom maroon number. So for example, on May the 24th, there were 465 tests reported to the health department in Polk County. Of those 465, 2.8% were positive. So this is a good way of looking at the overall daily number of tests. Our goal is that we test an average of 500 per day in Polk County. Some days we get a lot, like that 1,946 tests on the 19th was actually the result of Merlin reporting a bunch of negatives at one time. There was priority before that in making sure the positives were reported so that the health department could jump on those investigations. So that was sort of the data dump on that day. I cannot tell you there were nearly 2,000 tests on that day, but those were the days the tests were reported. But over the past week, if we exclude that one day, we're averaging about 500 tests a day, which is a good goal. So if you go to the next slide, please. So back to the reason for why we are here. So my high-level message to you all as business leaders and community leaders is that we are still faced with COVID and local community transmission. As much as I would love to sit here and tell you that things are getting better, we're not quite there yet. And things have opened, rightfully, they've opened, but we need to stay vigilant with what we do, and you all are the face to the public, and making sure we are prepared to, you've already considered whether you're opening. In the middle column are the actions in place to promote health amongst your employees and to promote activities that people that use your place of business need to do. And then in the last column is their ongoing monitoring, both within your business and then in communication with local community leaders, like your city commission, like your county commission, like your hospitals, like the health department, to make sure that we all are aware of what's going on. So this is a resource from the CDC. And if you'll go to the next slide, then I'm going to be quiet and turn it over to Dr. Haight. And you will have these slides. This is just some additional resources. That is my email. If you want to email me after this is done, any questions, if I can't answer it, I'll pass it on to my epidemiology folks. We're still manning a 7-day-a-week COVID-19 information line locally. And then on the bottom is the link to the CDC guidance for business and workplaces, pages and pages of guidance documents. And there's also a link to an OSHA document, which I would point you toward. which is a guidance document from OSHA. My last thing is to, I would tell you or remind you that people don't ask to get COVID. COVID can strike anyone from the young to the old. It doesn't discriminate, although unfortunately it may be more prevalent in our African American population. But it's not, we need to make sure that people that develop COVID are not discriminated or ostracized, because nobody wants this condition. But it's upon all of us to make safe workplaces and an openness that employees can tell us if they may have COVID, or if they've been tested, or if they've been around somebody that's been ill. If somebody does test positive, that result will come to the Department of Health, but it may take a couple of days. What we do at the health department when we get a positive test result is we do what's called an investigation of the case. So we contact that person by phone and do an interview that can take 45 minutes to an hour. And we go through, have you had symptoms? When did your symptoms start? Where do you work? Who have you been around that could be exposed? We record this, and then we have contact tracers that attempt to contact those individuals who were exposed to make sure that those who are ill are excluded from work in the public, and that those who are close contacts are likewise excluded. We are very cautious to respect people's confidentiality. So if Betty Smith, if we find out she's positive, we cannot call her employer and say, hey, do you know Betty Smith has COVID? No, we suggest, we ask your employees to let their business owners and their supervisors know. If we start seeing that multiple people or several people from a single business have tested positive, then we may reach out, not giving names, but to find out if that business is aware. And we have had some fortunately fairly small outbreaks in businesses, and it seems to be in manufacturing and call center places where employees work very closely together. So we are happy to work with businesses if you recognize there's an outbreak situation, or if we can connect the pieces through individual cases. We are very happy to work with businesses with guidance as we go forward. And I have a team of contact tracers and epidemiology staff that are ready to help you if there is an issue. We would rather nip them in the bud sooner rather than later. So I'm going to stop, and I'll be happy to answer questions through chat later on. Thank you.
Great. This is Daniel Haight from Lakeland Regional, and can you hear me okay? I'll see if Lauren, perfect, okay. Here at Lakeland Regional Health, I'm the Vice President of Community Health, and I'm an infectious disease specialist here, Director of Medical Infection Prevention, and also I'm a professor over at the University of South Florida. Right now in the hospital, we have about 56 patients with COVID positive test result, and about 20 that are pending, 2 of them on a ventilator. Most of those patients are doing stable and are recovering, and just moving them through this journey. I do want to start to share my slides, so let me see if that can work. Okay. And Lauren, that seems okay? All right, perfect. Some of the things we're not going to cover today are the things you've already heard a lot about: the symptoms, how is this disease spread, some of those more common things, but those are very important that you as business leaders have a basic understanding of and share that as a knowledgeable person to the people you work with, as part of your leadership, to know the basic science and know where to turn to get the questions answered that you need that will come up, especially if you keep seeing something on the news or you keep hearing something from medical folks and you're not quite understand, well, why is it this or why is it this way? Get those answered so that you become even more knowledgeable and more comfortable with the topic, and that will make others around you more comfortable, especially those that you're leading. One thing, if your business is a little bit larger, is to even designate a particular person. And one of their things that they do during the day is their job is to, and this may be your job, but is to be following this on a daily basis, checking in with local media, reading news reports, keeping up with the new advancements, and then giving that information to you. This is very important to just keep up to date as everything is changing so much, and it really helps to have one person have that role to really pay attention to those areas. And some of the areas they would go to are the Centers for Disease Control, and as Dr. Jackson outlined, there were so many helpful resources from the Department of Health. And if you are needing to work with the Department of Health, devoting that time when and if they might call to help them do their jobs. But their websites from the City of Lakeland and Centers for Disease Control and Florida Department of Health, very, very helpful to move things along. Some of the things for our businesses, as you know, some of the advice that's given, I won't go over some of the things you've already heard repeated many times, but I'm trying to try to give little nuances that I think do help. One thing is obviously the hand hygiene, but also I think many customers and coworkers do appreciate that when you enter the business, that hand sanitizer, hopefully if it is available, is right there and encouraged to be used. So as I walk into a business or a restaurant or up to the front counter, a greeting of, welcome, here's some hand sanitizer if you'd like to use it as you enter and leave. That is a little extra reassurance, and I think it starts things off on the right foot. Of course, as somebody touches their nose or coughs into their hand, which we shouldn't be doing, then hand sanitizer available after that is very helpful too. There we go. Yes, you've heard a lot about this, that the masks are generally used in the hospital when you're very close to a very sick person that you know the virus is coming out of them. Certain types of very strong masks help protect the healthcare providers, and they use eye protection too. But out in the community, the masks are providing some protection, but the masks are really helping those people who may be shedding the virus but don't even know it. And they're feeling fine, they're out in the community, but wearing the mask helps prevent that germ from leaving their mouth and nose and getting onto their hands and other objects. So that wearing the mask is actually very protective. As you know, there's many different kinds of masks out there, and you want to be careful that some of the masks that you might be wearing or your employees wearing, that they're not actually restricting air, causing headaches or causing trouble breathing. Sometimes the materials might be the improper materials, so be real careful to look into that because we could see that I've seen some wonderful designs on masks, and even some of those have actually been impenetrable to the flow of air. So we want to be cautious with that, and there's lots of good advice out there on how to properly make your own mask, and then hopefully we have to watch the supplies very carefully as they're not quite there yet. But I think the main message is wearing a mask is what you do to protect others, because you may unknowingly spread the virus before you become sick. So that's a key point there. Now, in the businesses, you've always heard a lot about how to wipe down commonly touched surfaces and things like that. And that is part of the good news that we did share quite some time ago, is that this virus is a relatively delicate virus. It's got a coating around it that is easily destroyed by some of the most common cleaners. Cleaners that have 60% alcohol, the other common household cleaners. In fact, using concentrated bleach is not necessary. You would use diluted bleach. And again, there's advice on how to create diluted bleach. And you'll have already seen a lot of this. So a couple of things I want to really emphasize is, one, make sure you pay attention to when your cleaners are expiring. At some point, the effectiveness in destroying a virus becomes very limited as certain cleaning products age. And at some point, you're basically using water and you're just spreading the germ around and you're not really destroying it. So take a look at those expiration dates to make sure that you are using a fresh product. If you're mixing your bleach yourself and making a diluted bleach solution, which is a little bit on the strong side, for this, but again, that expires after 24 hours. So the second point I want to make is make sure that the product you're using makes the surface wet enough. Now that can be everything from using hand sanitizer, and when you put hand sanitizer on, your hands have got to stay wet long enough to destroy the virus. If you put the hand sanitizer only in the center of your palm of your hand and move it around and don't get it to the fingertips where they're wet long enough, it won't destroy the virus. The same is true for the wipes that you pull out to wipe commonly touched surfaces. If the wipe has already dried out, it's not destroying the virus. So make sure the wet time, and each product we usually say that the surface should remain wet for so many seconds, a minute, depending upon the product and depending upon what you're trying to kill. COVID, this virus, tends to be killed relatively rapidly, but it still has to get wet long enough. And of course, protect yourself when you are using these products that might harm your skin. Again, we often have to remind people that you may know this, and you may know this, but you may need to share this with others who may not. Mixing common cleaners like bleach and ammonia can be toxic. And you put bleach and ammonia together, and you produce a cloud of toxic gas that can be harmful. So, most of us know that, but you want to make sure that your younger employees or those who may not realize that certain products, you really have to read the ingredients to make sure, oh, this one has ammonia and this one has chlorine. And again, you don't want to overkill this because it is a delicate virus, but you do want to clean those surfaces. Also, just a few ideas. If you have employees that are working at a workstation and they share that workstation with another shift and somebody else is going to be coming in after them, always have that person clean at the end of their shift and have them focus on the things that they have touched and the things that you think are commonly touched. But then when the new person comes for the start of their shift, have them also wipe at the beginning and the things that they would touch throughout their shift. And of course, if they were to cough or touch their nose or blow their nose, and now they got germs on their fingertips, because even if you use a Kleenex, the germs soak right through the Kleenex onto your fingers. You've got to then sanitize your hands, and if you, of course, touched anything, wipe them down throughout the shift. Another good idea when doing routine cleaning is, if possible, you may not have enough team members to do this, but if possible, have people rotate in what they clean, because one person might clean 90% of what needs to be cleaned. No one's perfect. And we will see that the next person will then clean 90% of items that will be slightly different. And so you get a beneficial overlap in that case. Now, there are a couple of special circumstances, and I think this will also help where you generate your questions, because we can't sort of guess everything, but I can think of some common things. First of all, when it comes to your customers, keep in mind that you may be doing a lot for their benefit to make this a safe situation. And you have been making some great decisions, but sometimes even the best decision doesn't get quite appreciated unless it's communicated on how much time and effort has gone into doing things safely. So sometimes you may be doing, for example, a lot of cleaning, but you often want to do this in plain sight of your customers and your team members. So they get that feeling that you're trying and you're doing this. So do keep in mind, you may find it could be a bit duplicative, but doing it so others see it is a key concept. So, sanitizing your hands so people see it, wiping down surfaces just before they sit down or come into your place of business, using pens, that there's a container for pens that have been cleaned, and then a container for pens after a customer has signed, is just other ideas. And again, you're seeing this throughout the community, but we want to share best practices. Also, when possible, ask your customers and your team members for their own advice and suggestions. Again, you cannot implement every idea, and not every idea is a good idea, but you do want to have that dialogue. So do take a point in saying, do you have any suggestions? But be prepared if the suggestion is sounding good but not possible, you are prepared to describe how you're able to address their overall concern, but maybe sometimes you cannot actually commit to any idea. But do have that dialogue so people feel comfortable that you are addressing their concerns, because they may bring up some actually good points that you could consider. And that might be the best ending to a suggestion would be, that is a very interesting suggestion. Let me discuss that with our team or leadership. So keep that in mind. Now, there are some things that are going to happen, and I think you do have to be prepared for that. Dr. Jackson sort of brought up a couple of things, and it's the what ifs. What if one of your team members is told that they were exposed, whether it was from a relative or a friend or from somewhere else outside of the employment? You want to understand how to deal with that. Now, the health department is there to be able to answer common questions, but you want to be prepared to know, well, who to call, what kind of questions would you have, and try to sort through that. But then, a common issue is that, well, if somebody gets exposed, should they be tested? Now, the test is looking for the germ. So often, if you are exposed, you may not have the germ coming out of you yet. It has to incubate. And often we don't understand yet the full timing of when does the germ, if it does cause an infection, when does it start coming out of a person? And clearly when the person is sick, it's definitely coming out, but apparently we've learned that before a person has symptoms. But if you do a test, that's just a second in time. It's at the moment that you take the test. The test could be negative, so it may not be very helpful to get testing in somebody who has no symptoms and if they've only been exposed, because if they're negative, well, they could turn positive 6 hours later or the next day. The key issue is if you've been exposed is to follow the instructions that the health department has given about quarantining. Now, that's a word that you hear a lot. Quarantine is something you do if you're healthy, but you've been exposed. And there's special instructions on how you should be quarantined depending upon your situation. And key thing is if you start to develop symptoms, that's when you need to seek attention and of course, testing at that point. Now, there's another question that comes up. What if one of your team members does become sick? There are still many germs out there that are causing fevers, causing body aches, but getting medical attention is key to determine whether this could be COVID or not. And the main thing is to not to work while you're having a fever or having symptoms, because you can spread it to the office. So be very conscious of caring for your team and doing that. And many of you are already doing that, keeping an eye on your employees and having procedures in place if somebody's not feeling sick. But be prepared. What if one of your team members is admitted to the intensive care unit or is very ill, both as you may be a big family basically at work, and how you care and share your concern over somebody being sick. But also it's the role they may have had at the office or at the business. Is that person doing something that no one else can do? And so you want to be prepared for that, for how to respond to that if a key team member does become sick. Also, what if a team member has a relative that's very close to them, and if they become sick and are in the intensive care unit, maybe at a distance, maybe it's in a different state. Again, you can imagine the concerns that would happen as if it was just one of your family members or team members would have that happen. Also be considerate of social media. What if social media starts posting information about your workplace? And it could be rumors, it could be true. Are you prepared to respond to social media if there are postings regarding your business? And how do you best respond to that? You have to think ahead to know how to do that. Or what if the media, news media, turns to you and wants your spin or your outlook or your opinion? Be ready on how you can convey the best information that is helpful for you. I do have here on the slide, you see what happens if one of your team members does become sick and they test positive and they are recovering. When is it safe to come back to work? I've been doing a lot of talking, so I apologize for that. So when is it okay to come back to work? So there are two methods that the Centers for Disease Control uses, and again, I offered Dr. Jackson if she has any additional comments. These have changed over time. There's been two methods. Certainly, if a person has gotten sick with COVID and now they're better, to come back, one method is to get a test, and if it's negative, repeat it 24 hours later, at least 24 hours or more. And if the second test is negative, that pretty much clears you. Now, there's a problem with doing that first method. It's great if it works out, but it's not good if the test remains positive. And as studies around the world have shown, is that after a person has gotten better, the test may remain positive for up to 30 days. Now, what part of this is, the virus has many parts to it. The test is looking for one small particle or little particles inside the virus. And what the test does is it actually amplifies that little piece of virus millions of times so that the machine can recognize it and measure it as a positive result. So what's happening in some patients is remnants or pieces or particles of the virus are still remaining in the recovered person. And sometimes these particles are not infectious, but there's enough little pieces around that are coming out when they do the test that cause the test to remain positive. So that's a little frustrating as we've seen that a person can remain positive. And there's not a easily available alternative to prove that these are not infectious particles. They can do that, but that's only done in very special labs that try to grow the virus, and they don't have that available. So we're sort of left with option number two, which is on the Centers for Disease Control site. And the key thing to remember there is if a person is sick with COVID and they're positive, you take the first day that they developed symptoms and you add 10 days to that. Now, after 10 days, they can return to work only if they have been healthy for the last 3 days. And so the key measure there is you've got to be free of fever and the body aches and the coughing, or at least be incredibly improved. Some people have a chronic cough from sinus problems or allergies. If it's returned to normal, okay. But you definitely want to see 3 days of marked improvement. And whatever that third day is, that day has to be at least 10 days from the first day you got sick. So again, a lot of information there. Please be flexible with this. There are a lot of things that change. In fact, what I just said, it used to be 7 days. Now it's 10 days. So, things do change. And sometimes we don't get all the notification of here's the different advice. So it is a moving target to keep that in mind and just be open to, oh, I didn't know that kind of a response. And I'm glad you told me, because I was not aware of that. Those things are things I hear frequently because the information is changing. Lastly, we want to try to make sure our team members know, because you're involved in this, as to how to try to stay safe, even outside of work. And you can give that advice if people are asking you what would be good ideas or not. And again, you've heard all the things about social distancing and wearing a mask, and please encourage that with your team members and through your businesses. Also, we've been very, very concerned about people ignoring general health conditions that can be dangerous. So if you're a person over 50 and are getting severe indigestion and you're sweating and you have a little history of a little high sugar and a little high blood pressure, that could be the signs of a heart attack. Especially in women, the signs of heart attack are not always chest pain. Same thing with stroke. We don't want anybody to wait and not seek medical care if they're having trouble speaking, if one side of the face is drooping, or they're dropping objects or weak on one side of their body. This could be a stroke that could be reversible. Our hospital is separated into where we can safely take care of non-COVID issues and take care of COVID patients and maintain safety so that you can come in and get immediate care as soon as possible. And this has been very important. We don't want to see somebody have what is starting or appearing to be a mild condition turn into a severe condition that could be irreversible. So please make sure your team members know to seek medical attention. Get on the phone and talk to somebody if you're unsure, but call 911 and get medical attention for severe medical problems, because we are seeing people showing up too late. Now, as the summer will eventually end and we'll be getting into the colder months, we will definitely encourage people to get the flu vaccine. We do not need, on top of 100,000 deaths from COVID, an additional tens of thousands of flu deaths and the hundreds of thousands of hospitalizations that we can see. And the flu vaccine is safe and it's effective, and it helps reduce absenteeism from the workplace. It actually even reduces other problems such as heart conditions, and also reduces hospitalizations and complications. So please encourage the flu vaccine. This brings up another issue. I mentioned earlier about what to think about and what to plan about. Well, we also start to have to think about hopefully the vaccine for COVID that may eventually be available. You know, when is still up in the air, but you're going to have to play a role in encouraging this or understanding it and working through the issues. What if one of your team members refuses the vaccine? Well, we haven't gotten there yet, but we're going to have to start thinking about what does it mean to get this vaccine? How effective is it? How safe is it? That's the information we'll have to be seeing, and you have to be looking out for it. And that goes back to that original, make sure somebody in your office is designated to keep an eye on these topics. It may be you, but if you have a big enough organization, it may be somebody you trust who every day they're looking into, well, what is the plan for vaccination? What is the best thing to do for a particular situation related to this? Also, you know, those of you who are on businesses that are with other similar businesses, definitely encourage you to reach out and ask, well, you know, what are people doing in similar businesses, and share those best practices. Some of you are in large enough organizations that you have societies and organizations that have already done this. So you've already received a ton of information. But for the smaller businesses, you know, do reach out and look for best practices and actually learn from others' mistakes or from your own. So you'll definitely have the opportunity to know, oh, you tried something, it didn't work out, and you learned from it. So we're all going to be learning from, you know, things we could be doing better. And we're being prepared to change. As you saw, there was the recommendation not to wear masks out in public, and you saw how that changed. And we need to just go with the flow and understand, well, what is the best science behind this? So I think just wrapping that up, the last thing is, even though it's under a mask, please continue to smile and try to, you know, look for what is the opportunities out there as we're all working to make sure that this disease doesn't have the horrible impact that it could have. And we're just doing our best there. So I'll turn it back over to you.
Perfect, thank you. Yeah.
Okay, you have a number of questions in queue, I would imagine?
Yes, so we'll go ahead and get started. The first question is, what are the requirements to get a test? And then following that, do you have to have symptoms or know that you came into contact with someone in order to get a test?
Who do you want to address that?
You can go ahead and begin, Dr. Jackson.
Okay, I'll start, and then Dr. Haight can jump in, or Lauren. So we've gone I won't say full circle, but you know, a number of weeks ago, testing, because it was so limited, was pretty much available only to those with symptoms or those that were close contacts and were an at-risk population. So there's a little bit more availability now for some testing being open to at-risk populations that are not necessarily symptomatic. So the testing opportunities in Polk County are from an individual provider's office to the hospitals if somebody becomes ill and goes to an emergency department, to those that are testing in the community to at-risk populations, which is Central Florida Healthcare and the health department are doing community outreaches, and we're not requiring symptoms. So it's somewhat variable, and then I'll let Lakeland Regional speak to their drive-through. And also Baycare is still running their drive-through in Bartow. So I'll turn this over to Dr. Haight for his update.
So we do have a respiratory care center, which was set up on Pablo Street near the Southgate Mall. They're around Edgewood and South Florida Avenue. It's actually on Pablo Street. And the respiratory care center is there. You can have appointments or walk in to assess symptoms that you're having if you have concerns. It's more for something that has come on new. It's not necessarily for something that's been there for years and years, but you know, again, helping to address COVID situations. And there you can be assessed to see if a testing is a good idea or do we need an X-ray, and sort of the whole information can be put together and questions can be answered. There's also to be something you can schedule is the drive-through testing that we have at the RP Funding Center. And there you can bring in a prescription from your physician for testing, and they do the testing there and you'll be notified of the results. Or there is a number to call to, you can get assessed with telemedicine, where through the technology, you can get a connection with a clinician who can assess your situation, answer your questions, and if it's the right thing, then get the testing all set up. Again, in all of medicine, we always try to look at testing with regards to what is the result going to do differently. For example, you know, if I had a positive test, I would know to alert people around me that I could be contagious and they need to watch out. Or, you know, you can just imagine how you would respond to a negative test or a positive test. So in medicine, we tend to always think ahead. You know, what is this going to do for my overall care if I get a test? And that's true for any test. So that's where in the past, as Dr. Jackson mentioned, that, you know, when we didn't have a lot of testing and you were relatively young and healthy and you had a mild illness and you think it might be COVID, well, would I do anything different knowing I had COVID? And the answer often was no, just go home and make sure you don't expose others and take care of yourself until you are recovered. Now, as we can learn about certain populations at risk, it's important to know the test results in certain circumstances. Do want to ask if Lauren has anything to add about Lakeland Regional Health's testing opportunities.
The only other thing is you can visit mylrh.org, and on the homepage, there's a list of all of the testing opportunities, as well as the numbers to contact or the website to click on where you can actually access the virtual telehealth session. Pretty much like Dr. Haight said, the respiratory clinic is one of the best options because you do have the ability to walk in.
And I will also add that, again, throughout medicine, no matter what aspect of medicine you're looking at, there are tests that can be falsely negative or falsely positive. Now, this test tends to be, if positive, it's pretty believable, especially if you're having symptoms. I think it's a very believable result if you're positive. But if the test result is negative, we still have to be cautious. I mean, here at the hospital, we still take cautions even if a person is negative and they have all the signs and symptoms and they were exposed because they had a close contact. We're very careful to determine whether we can believe a negative. So always keep that in mind, if a test is negative, there is a small percentage that can be falsely negative, and it all depends upon how the test was collected and that particular person's symptoms, the infection may be deeper down if they're even more sick. So there are things we take into account. Thanks.
Kirsten, if I could add 2 more things really quickly. I want folks to be sure that you understand that the acute testing or the PCR RNA testing really only tells us if that person is shedding virus on that particular day. So we're very careful when we're doing community outreach, which may involve testing people who are asymptomatic, to let them know, you know, your test may come back negative, but that doesn't mean that you're either not percolating the virus, or it doesn't give you free rein to go out and not follow social distancing, because all it tells us is at that moment you've tested negative. So that's very important for people to know. That and the big question we get asked at the health department is that my spouse or the person I lived with has COVID and I want to go to work. Can I have a test to make sure I don't have COVID? And the answer is that's not the best way to deal with it, because if you're exposed and you're going to contract COVID, that could happen anytime in the next 14 days. So we would literally have to test you every single day to know that you're not shedding virus on that day. So if you were exposed yesterday, we can't test you today and tell you you're not going to come down with it, because you could come down with it at any point during those 14 days, with the average being between 5 and 6 days. But there have been cases up to 14 days. So you can't do a fast pass to test people who were exposed. They still need to exclude for the 14 days.
Following up from that, what are your thoughts on the COVID antibody test? And this is directed both to Dr. Haight and Dr. Jackson.
So the antibody test, there is still no final word on that. There are the tests being done. Certainly, it is clear that patients that have been infected, they begin making antibodies. So that's the first thing I'll emphasize, is what we do know for a fact, that you do not begin making antibodies to the point that this test can pick it up right away. There is, with every disease where you make antibodies, there's often a delay. And that's different for different diseases. So it may be negative when in fact you have the virus and you're fighting it. So it takes a little while for you to build up the antibodies to where you are, the test is positive. The big question is, are these antibodies protecting you? And they are leaning in the direction of probably, but we still need to prove that. And then the other question is, how long is it going to protect you? Is it going to just protect you for this season and then start to wear off and you could get infected again? So they have been finding some information that they don't see a lot of people getting reinfected right away. And this has only been around a short few months. So that's encouraging. And then, and so we'll have to wait to see if a positive antibody test means that you are protected. Now, it usually means that you've been infected. But there can be false positives. And what I said earlier about the PCR test, where you could really believe a positive there, antibody tests are a little different. There are more false positives with antibody tests than there are with the other tests that we've been doing, like the PCR test. So I have to be a little concerned about the accuracy of these tests. They can be false positive, they can be false negative in the circumstances I described. And we'll have to wait and see if they're protective. Then the last question is this is tied into how well a vaccine will work, because what a vaccine does is tries to get your body to make your own antibodies. And they're trying to pull all this together. And that's where you start hearing about people donating their plasma. These are people who've recovered and from COVID, and they have made their antibodies, and they've tested positive for antibodies, and they're donating their plasma so that it can be given as convalescent plasma to a sick person. And it's basically giving antibodies from another person to the sick person while that person is making their own. And so it's trying to get a head start.
Thank
I
you.
do think it's also important to note that there are a number of antibody tests coming out from various organizations and businesses and corporations, and not all of them have been properly validated yet. So again, as we're learning more and as more validations come out, that's really, it's going to take months for these things to be properly validated to really know the accuracy of the antibody test.
Thank you. Before I ask the next question, I just want to let all attendees know that both doctors have graciously decided that they'll be on the call for an extra 15 minutes so we can try to get through all these questions. So the next question is, what is the observed data on patients that are asymptomatic? And in addition to that, what is the useful life of a mask that is used in the workplace? So how often do we need to switch or wash those masks?
So I'll take the first part of the question. There are different estimates as to what percentage of people with COVID may be either asymptomatic or they may be pre-symptomatic when they're tested. So I've heard data from upwards of 30 to 50% of people who actually have COVID may be so minimally symptomatic or asymptomatic, and these are actually individuals that may be helping to spread the virus. Generally, people who are sick are shedding more virus, so they're more contagious, but those that are not manifesting symptoms can still spread the infection. From the standpoint of mask usage, Dr. Haight, you guys have a lot of experience with that and reusage at Lakeland Regional, so I may punt that one to you.
Well, again, the key part is you've got to do what's needed to protect yourself. So any mask that is worn, torn, moisture, even when makeup builds up on the mask, anything that impairs it, that's telling you that the lifespan of the virus, of the mask has reached its end and needs to be replaced. The washing, pretty much as you're exposed to someone with COVID, you may have the virus trapped in the mask. So we're always telling people to handle the mask from the edges. You don't want to grab the front of the mask where you'd be on your fingertips. So that's where you would sanitize your hands after if you did touch your mask. And the lifespan is a lot on, unfortunately, has been based a lot on supply. We are actually beginning a process of using ultraviolet light and hanging the masks up if they're in really good condition, and using ultraviolet light from both sides of the mask that's hanging to basically destroy the germ, because it is that delicate germ where the energy from ultraviolet light does that. But it is pretty variable in how long the mask will last, but always have people inspect the mask to make sure it is functioning properly.
Thank you. The next question is, since the COVID-19 virus is a virus, what is the likelihood that a vaccine will be developed since viruses mutate?
So I'll start, and then Dr. Jackson can wrap up, is that this virus does mutate. The characteristics of the flu or the influenza virus, those mutations can make significant changes in the flu virus. So the flu virus, when it duplicates itself in your body, one virus goes in and millions and billions come out, they're not all identical copies. And some of them are very bad and they don't go on to infect others. Others are actually a little better and they change. And the flu virus mutates and the flu virus changes to the point where your immune system has a hard time recognizing it when it comes around next year. The coronavirus does have some small mutations that do occur, but those mutations tend not to make drastic changes in either how your immune system is going to likely recognize it, but they still need to prove that. But it doesn't seem to be mutating to the point where it's becoming a different virus, like a more serious virus or different symptoms. So we are not seeing it mutate a lot. And if you look at where the mutations occur, there are sections of the virus that haven't shown any mutation. And the reason is, if a mutation were to occur in those sections, the virus becomes a dysfunctional offspring. And so that's where the vaccine will be targeted to, is those areas of the virus that can't mutate, because then it becomes a non-infectious virus. So we'll hopefully see the vaccines focus on those parts of the virus.
Thank you. If an employee shares with me that they have tested positive, would you recommend that I share with other coworkers that they have been exposed, even if I am not a supervisor?
If you're not a supervisor, I think that needs to be escalated to a supervisor. And then within the workplace, we want to make sure to maintain confidentiality. We've actually had a couple of staff members at the health department that have tested positive. And when we talk to coworkers, we will say things like, somebody that works in your vicinity has tested positive. Then we analyze which staff could be close contacts. So we never disclose, but invariably staff members figure it out based on absenteeism, but we don't confirm or deny by the individual level. But leadership does need to know if somebody is positive, so that appropriate actions can be taken in the workforce.
And that brings up the point where, you know, we deal with this situation with a germ called MRSA, MRSA, you know, and that's a common thing out in the community, but that's what's part of the point. Some of these things are common out in the community, and we know that it's possible that anyone could have it. And that's where both privacy has become an issue too, because we've seen people overreact to learning that a friend of a friend of a friend of a friend has whatever disease. And we've seen people being treated differently, even though when you hear the story, there is no physical, medical, scientific way that that person could be involved, but just because they're a friend of a relative who knew somebody has a disease. So protecting privacy, but also dealing with the facts of what's the most common sense approach. Well, if you've heard information that is concerning, like she said, share it with your supervisor and take actions that do protect people in the common sense way.
Perfect. Can we touch upon, can we touch a bit upon the emotional well-being of our employees and how best to support them during this stressful time?
Yes, I think there's a few things I'll start off with. Is number one, you know, be prepared for interactions or conflicts with customers, with employees, because either people are stressed or they've adopted an opinion about this situation that might counteract with somebody else's opinion. And you can see this happening all the time with the negative interactions and arguments about it. So with everyone under stress, is to first recognize that right off the bat. You know, we're going to have some bad days. You know, this is going to be stressful days, and you've seen that actually. You know, and you know, in past jobs I've had, I used to tell our team members, you know, the holidays are coming up. You know, right before Thanksgiving, I say, you know, holidays are coming up, and this is a time where, you know, cash might be limited, and family might be visiting, and you may be having trouble juggling everything around Thanksgiving and the holidays and kids getting out of school, and your coworkers might be stressed. And just keep in mind that, you know, the reaction you might get during, you know, a conversation, it may be the stress talking, and give everyone a little benefit of the doubt that it may not be you, it may be they're having a difficult time, but get it out in the open to say, we're all here under a stressful situation.
I also do think it is important to note that we are obviously seeing an increase in behavioral health issues in our community as people are dealing with a number of issues. And so for sure, there is a sensitivity that needs to happen in your workplaces. If you visit mylrh.org/business resources, there are a list of documents, resiliency tips for employees that our Director of Behavioral Health Alice Nuttall and our Director of Pastoral Services have put together. In there, they talk a lot about taking your employees' emotional temperature daily in addition to their physical temperature, asking them, how are you? How is your family? Really kind of diving into that side of things so that they know that they are supported. In addition to that, really encouraging those that you know are struggling to seek help. You know, that is one of the most important things outside of the physical condition. The mental health condition is equally as important, and we really want to make sure that people are seeking help in our community. We have behavioral health services. There are a number of organizations in our community that do a phenomenal job in dealing with behavioral health. Peace River is a great organization. So there are a ton of resources out there, but definitely check out those resiliency tips on our website. I think it'll shed a lot of light on how to assist your employees.
Thank you. We have about 3 more questions left. The next question is, have any multi-system inflammatory syndrome cases been reported in children in Polk County?
No, not at this point, not that I'm aware of.
And again, just to note that that occurs sometime after an infection, that the parents may not have even realized that their child had a COVID infection. It might have been mild, and more and more will be learned about this. But is this a sort of an exuberant or overreaction of the immune system that is causing secondary problems? But you'll see those kinds of signs and symptoms, and keep in mind that in a place of business, this may be a huge impact of just hearing about these cases. So if the first case is reported in your community, or it's a unfortunate severe illness or a fatality in a child, that's going to change the dynamics of some of your team members that are parents and then that are concerned about their children and the what ifs. What if I catch it and bring it home to my family? What do I need to do at home? These become very serious. And I think for some businesses, to understand that that could have a severe impact on just day-to-day function, stress level. And again, we want to be there to help to try to get information that helps parents understand the risk, what to do. And we want to be real careful that we're not always just telling people information. We're giving them actions to do. We're giving them ideas, and we're hearing from them. What do they want to see? They want to see more information. They want to see something different, is to try to address that, but also give people things to do that make them feel that they've got some control over this, because having your child become ill becomes like you're losing a lot of control at that point. So fortunately, this has been very rare, but our local emergency rooms and pediatricians are very much up to date on what to look for and how to answer parents' most common questions.
When bringing in grocery items or other items into our homes or our businesses, how do you recommend disinfecting those items, whether they be food items or boxes?
The CDC actually has guidance on this, and my recommendation, because COVID can live on certain hard surfaces, I think the odds of contracting something from the grocery store is very slim. But if you want to wipe things down, that would be okay and let them air dry, but it's not really necessary or required. What I do when I bring my bags in is I don't wipe individual items down, but where my bags have set on the counter, I then clean my countertop. So I wouldn't obsess too much. My daughter lives in New York City. When they get packages from Amazon, they let them sit for about 24 hours before they open them. So there is some guidance on the CDC, but I would not be overly concerned about contracting something from a grocery item.
I agree. Time is your friend, and letting things sit. That virus needs a very good environment for it to stay infective. And it's very delicate on the outside, and it starts breaking down to where it cannot stick to to you and get you infected. And again, hand hygiene will go a long way. Keeping your fingers away from your eyes, huge benefit there.
And for our last question, what is the state of ventilators and hospital beds in Polk County? And in addition to that, what is the average hospital stay for a COVID-19 patient?
Dr. Jackson, I think you have a good summary of the state of the county.
So we've been having a weekly meeting with hospital representatives, which has been extremely helpful. And we basically go over the data, how many COVIDs, how many folks are in ICUs, how many people are on ventilators. And I have actually, and I need to knock on wood, our hospitals have done amazingly well in supporting their staff, the patients in the community. And we have adequate ventilators, we have adequate ICU beds, and we have adequate hospital beds. I also want to bring up, and as a reminder, that of our 900 cases in Polk County, this represents 0.1% of the population have been diagnosed with COVID. So on one hand, it is really pretty rare, but on the other hand, we still need to keep our guard up. But again, our hospitals have been extremely supportive and are doing well.
I do feel that, you know, many of us, it's our job to worry. And, you know, I will want to always bring an umbrella. And if I bring the umbrella, it's not going to rain, but I'm going to worry. I'm going to worry about it. And when I see that, you know, I've seen some early antibody results, and not very many people are positive for antibody, meaning not a lot of people have come down with this disease. And the ones that did come down with the disease, we tested them for antibodies and they were positive. So I got some confidence in the test that I will hope to learn more about as more data becomes available. But what am I worried about? A lot of people have not met this virus. And again, as Dr. Jackson had said earlier, 20, 30, 40, 50% may not have any symptoms, may have mild symptoms, but it's our older population that has done an extreme job of protecting themselves, staying at home, being very careful, but there's a fatigue involved in this. And some of the cases I've seen, little clusters of infection, it's been because folks have taken their masks down, they've gotten into conversations 2 feet from another person, weren't feeling that great, and then got sicker that night. Well, guess what? The person that they were with, they're positive too in about 4 or 5 days, and hopefully they didn't spread it to anyone else. But what's going to happen is that increases in a population that has not seen a lot of these cases. And we have folks that, due to health disparities, we saw the number of cases in African Americans be higher in the number of deaths. And so we have that concern, that access to healthcare and what conditions people have already existing: diabetes, obesity, high blood pressure. We've got a lot of patients and people that have those conditions. So we're going to have to be watching this very carefully. There is not an overabundance of supplies when it comes to masks and protective equipment. We are still worried about these issues. So we're going to have to watch this very carefully in the weeks and months to come. As you're seeing countries like Brazil, where it's their winter time, they're having a massive outbreak. And they have a lot of healthcare problems to begin with. We're in better shape. And as Dr. Jackson mentioned, the cases are at basically a plateau right now, but we're going to have to watch, what happens with all the returning back to business. So I have to be very careful about that.
Perfect. Thank you both, Dr. Haight and Dr. Jackson, for answering all those questions. I'm going to turn it over to Kim now to wrap us up.
So again, I just wanted to thank all of you for joining us today. Doctors Haight and Jackson for their time and expertise. And again, this has been recorded, so it will continue to be a resource for you. You also can, we also will be emailing to each of you a link to resources. And I'm certain, given the fluid circumstances of this nasty pandemic, there will be other opportunities for us to get together and discuss the challenges and the opportunities for improving our reaction in the community. So in the meantime, stay vigilant, stay strong, don't fall prey personally or professionally to the fatigue factor that Dr. Haight referred to. It's going to take us all having a bit of a behavioral change on our own as to the vigilance factor. I know myself, I'm getting a little fatigued from working from home all the time, but I think it's serving all of us well to be most conservative in our response and use an abundance of caution daily. With that, I'll say thank you again and stay well.